Hi, my name is Dr. Arthur Mark, and I'm one of the orthopedic surgeons here at Seaview Orthopaedics. I'm here with one of my patients, Tito B. He had significant problems with his knees. He's one of my patients that I had taken care of in the past. He had 2 knee replacements. But what's most unique about him is I don't get to really work with too many elite athletes. I consider him one of the elite athletes. He's a, believe it or not, a power lifter, and he currently holds the American record for, what is it? Deadlifting and
all of them.
Scott, all of them. And he competes actually locally in a gym here in New Jersey. And he's here to share some of his stories about his experience of getting his 2 knee replacements. So what caused you to have all this pain? You know, how long has it been hurting you before we had started?
Let's start a little bit back. Okay. Back in 1914, I competed at the national. And after the meet, I started pain in my knees. And so I took a couple weeks off after the meet. So I went back in the gym, and after a couple of weeks, my knee started hurting again. So then I got a letter from the USPL Powerlifting Federation telling me that I qualify for the world. And I went to see a doctor, and he told me that my college was gone. So I said, what can I do about it? He says, a knee replacement. I didn't want to have a knee replacement at the time because that meant my chance to win the world was gone. So then I did the world and in South Africa, and I did win it, the world. After I won the world, I started to look around for to care of my knees, and I saw a doctor. But when I came to you for a second opinion, you made up my mind that you were the doctor for me.
So before the surgery, did you have any injections or any other therapies?
I did. Did not work.
Okay, didn't help you.
No, did not help.
So then over a period of what, it was about 6 months, we did your 2 knee replacements. Right. Your left one was a little bit complicated by that you had torn your quadriceps tendon before.
Right, I ripped up my quadriceps tendon, believe it or not, during the national, and that was 2011.
And then you had it fixed. So one of the things we did was to do a kind of a minimally invasive quad sparing, because you need those quad muscles to do the powerlifting to really try to preserve as much of the quad muscle as possible. And that was able to you to get back to powerlifting pretty fast.
Right.
So tell me, after you had both the knees done, what happened after that?
Be honest with you, I did not think that I could go back where I left off. Eventually, you know, when the state came around, I was up to where my normal lift was, and I was happy with that. I really did for my head. I want to know if I was good as I was. And I broke my record, and believe me, I was a happy guy.
Oh, good.
Not because I broke my record, because I knew that my knee now was good as ever.
Mm-hmm. And so you're a lot less pain when you train now.
I have no pain when I train. When I used to train before, I have a lot of pain.
Yes, I would not recommend this for most patients. He's in the gym 7 days a week, I'm sure, training.
Mostly 4 days a week, no less than 4 days a week, and at least 3 hours in there.
Yeah. So it takes a lot of work and dedication to get that. But it was, what, 7 months after your last surgery that you set the record?
My operation was in September.
Mm-hmm.
I didn't start training just before Christmas, and I competed August 6th.
Okay.
So that was it. But I really didn't start pushing until middle of March. I think when I came to see you and I asked you.
Right.
Yeah, and it was after that I saw you, and you said, "Go ahead, but be sensible."
Okay.
I'm happy.
Good. I'm glad you do. So hopefully we may see you back again next year, you know, after you compete in Worlds, maybe even set a new personal best.
Well, like I said, I'm happy to where I am now.
Okay. Mm-hmm.
I was afraid I would never get to be powerlifting again and get to compete and enjoy the sport. No,
right.
I know.
It's something you got to enjoy. So
right.
There's a one take-home message that, you know, if the knee are giving you so much trouble and there's something you really love to do and you can't do it because you're in pain, it doesn't matter if you're a a tennis player, a swimmer, a skier. We have good advantages that if you do the knee replacement, we can get you out of pain and then back to the activities that you love. And for you, it was something a little different, some powerlifting. And if you get to enjoy it for hopefully another decade or more to go.
Hopefully.
Yeah. All right.
I like to be around a little longer.
Great. All right. Well, thank you so much for sharing your experience with us.
American record is one for Tito B. Come on, Jersey Shore, coached by Jose Perez. Come on, Tito.